start the presentation, I opened it up. I thought it'd be good to just take a few moments to talk about just very briefly what we talked about in the past about what is AI and what are some of the uses of it, especially for therapists. I then was going to pass it over to Nouman to talk about some of the ways that AI can really help therapists in terms of their workflow and things of that nature. And then I was going to show some things, some ideas for how it might be used in a clinical setting as well, but a little more not quite ready for prime time, but at least something to talk about and some ideas to present. And then we're going to pass it along to for a discussion with a user, so you can basically get a nice broad overview of hearing some theory and seeing some things in practice and hearing from some people who are using it. So to start off, I have my disclosure is I'm working with CliniScripts, so everything I say is in that context. We talked about 3 types of AI. There is old school AI, which is basically where you take rules of humans, if-then statements, and apply them and codify them and develop systems out of that. That's kind of what I learned when I was in college. Then there's big data where AI figures out the rules. It finds out what correlates with what and then designs systems around that. But what we're talking about today is really the new school. It's basically large language models and machine learning. And in a lot of these systems, there are no rules. AI makes predictions and does stuff. It's far more powerful than what we've used in the past, but it also has a problem of not always being predictable. It doesn't have rules, but it's sometimes hard to understand why it does what it does. So we'll talk about the power and challenges of using some of those technologies today. I presented last time just a couple of examples of some of the immense power of these systems. Here is ChatGPT-4 doing better than medical students on board exams. So again, impressive that it's actually doing so well in terms of getting the answers right to questions. And this is a study in which compared an AI model to human physicians, primary care physicians, in terms of both issues related to accuracy as well as empathy and things of that nature in terms of how it's perceived by patients. Now, this caveat is this was done all through text, so it wasn't a real clinical interaction. It was simulated, but again, the computer did quite well, did actually better than the human, and as judged by experts in both terms of its treatment as well as in the empathy that it demonstrated to, or at least it appeared to demonstrate to the end users, and end users judged it. We also talked a little bit about ethics. Again, we spent a bunch of time on that, and we could probably spend a lot more because there's a number of things to consider when dealing with AI systems. We got to take privacy and security and always remember it and figure out how to maintain it and be utmost careful with it. And so it's something that is always on top of our mind. We got to review all recommendations. AI, the newest models of AI have what's called hallucinations. And so we got to make sure that we use it appropriately. And we have to basically be able to put it in situations where it's not going to cause harm, or we have the ability to double check what it's doing before it goes out into clinical use. We have to be particularly careful with patient-facing apps where we really don't have the ability to double check what's going on. We can't use AI to avoid patients. Kind of reminds me of telephone when you call up and things says press 1 for this, 2 for that, 3 for that. You just want to talk to a human. AI potentially can be a barrier to getting to talk to someone who you really want to talk to. And the final ethical issue is you have to take advantage of the benefits that the technology offers. It's incredibly powerful, has a number of advantages. The health system really does need help, and this technology is able to provide that. So that was the brief overview of things that we've covered in the past. And with that, Nouman, I'm going to stop sharing and pass it back to you.
Excellent. And thank you so much, Dr. Brown, for that quick overview. I'm going to switch over to a presentation deck. Again, I will definitely be sharing all of this with you through a recorded session on our website. Let me know if you can see it. I guess you can now. Okay. So today we're gonna deep dive a little bit more into some practical use cases. But before I do that, I want to re-emphasize and build on what Dr. Brown has talked about. Is what's the real problem that we are trying to solve, especially in the mental health space. Most of you are coming from a therapy or mental health background. So in mental health, we believe by using AI effectively, ethically, we can help save at least 20 to 30% of what we call non-billable activities. And what are those non-billable activities? Some of them I'm sure you know about, like note-taking is one, intaking patients, scheduling, doing initial assessment, billing I know is a big thing. And I know there's a lot of tools that are helping with scheduling as well. There's a few of them now in the intaking process, also in the note-taking, which we'll talk about as well. Technology integration, I know there's a lot of technology that is being now thrown at therapists, and you want to be able to bring it all together. And last but not the least, workflow automation and workflow issues. And what I mean by that, and I'll repeat it again, what we mean by that are when you go through a patient journey, there are a lot of repetitive tasks that you're doing. So is there a way for you to be able to automate it? Okay, so that brings me to the 6 use cases. We're going to focus on the first 4 today because the other 2 that I've encircled here are automate assessment and neuroback feedback integration with facial telehealth visit. Those are significant ones that I think need their own time because this is more of a foundational stuff. I think we're going to start with a few foundational use cases, one of them, which are now being widely accepted, right? So we'll start off with generative AI. We'll talk a little bit about note-taking. And as Dr. Brown said, because we are CliniScripts and we have that solution, we'll talk a little bit high level on that, but not too much. We'll most likely try to do a quick demo as well, and literally in about 30 seconds to a minute. We also have another solution, 24/7 AI chat. We'll talk a little bit about that as well, of how it will help. And then finally, the workflow automation. Now, in terms of the generative AI tools, again, I'm pretty sure that you have heard about ChatGPT. You might have heard about DeepSeek. You might have heard about Claude, Gemini. There's a few of them out there. There's pros and cons of using each one of them, but really the use case around them is creating content, planning for the treatment, client education, and administrative writing. And some of the people that we've talked about, they're also using it for note-taking as well. But the most important thing that I want to emphasize on generative AI is basically they are not, privacy is a major concern for them. And what I mean by that is that anything that you are putting in or discussing, or any question that you are putting on these tools is actually being is going into their large language model, is going into their database. So just like with Facebook ads and with Google, so they're collecting all that information. So that's the most. So there's definitely pros in it. So some of these are free tools, but of course, if you use the maximum benefits, then you will have to buy the paid tools for whether it's for ChatGPT or for Gemini or for Claude and DeepSeek as well. So that's on generative AI tools. Then I'm going to talk a little bit about the AI note-taking solution. Again, the picture here I'm showing is that there are more. By last week, we did a count. There's more than 100 AI medical scribe companies globally. Okay, and most of them are knockoffs, meaning that they are just a pretty wrapper on front of ChatGPT and other AI note-taking tools. What the things that you need to be careful about here is basically, are they focused on your therapy, like as an example on mental health? Are they able to generate notes automatically, and do they help you really save time? Are they built, as I said before, built specifically for therapists and mental health settings? Are they HIPAA compliant and PHIPAA compliant? HIPAA, of course, is in US, PHIPAA or PIPEDA compliant in Canada. And so the key there is, are they storing or are they learning from your data, which is something in mental health is very, very important. I talked about some of these like ChatGPT, DeepSeek, and Gemini. And I did talk about the biggest challenge with them is the privacy piece. There are pros and cons of using them, but be careful with what you put in terms of the prompt. And also you have to learn how to prompt as well. In fact, one interesting thing I wanted to let everybody know that in the software world, one of the biggest or the most promising job that is out there is called prompt engineer. So it's very, very important for you to put the right prompt, but you will still have this issue of the data being used by these large language models, whether it's ChatGPT, DeepSeek, Gemini, Claude, whatever that you're using. So then I started talking about the AI note-taking solution, Shahan. That's where I was alluding to this picture of 126 plus AI medical scribe companies. Most of them, as I said, are a pretty wrapper or an AI wrapper in front of these, whether it's DeepSeek, ChatGPT. But the most important thing I wanted to point out, and we will definitely be talking about with Sydney and Michael Lloyd in the second half or the third half of the conversation, is the important point being that you want to pick an AI scribe company which is focused on mental health, on the specific problem that you're trying to solve, number one. And number two, because mental health is very, very different. Like we as compared to the other 100 plus AI scribe companies, as you I'm sure would know, that typically when you go and see a primary care physician, you're seeing them for him or her for about 5 to 10 minutes. If you're lucky, for 15 minutes. A mental health session starts at 50 to 60 minutes, right? So there's much longer conversations. So the chances of inaccuracy, chances of hallucinations are much, much higher. There is multilingual. So people can speak in different languages. Some for countries like US and Canada, where there's a lot of diversity. So we have come across therapists who prefer to speak to their patients in their own language so that they can elaborate their point of view. So that's a very important piece. Thirdly, group therapy. So a lot of these AI medical scribe companies do not allow you to do group or having more than one person on the call. They get confused. So we are trying to solve that problem and many more other things as well. So these are some just 3 or 4 things that I quickly thought about are different from mental health as compared to some of the other AI medical companies out there. And we'll definitely talk more about it. But one most important thing that is not available on generative AI is the privacy piece. So I do come across a lot of therapists and other clinicians who are saying, how are you guys different as compared to a ChatGPT? But it's also all about prompts, and it's also all about privacy as well. So those are the 2 things that are very, very important. We try to actually do a bit of a competitive analysis. As I said, CliniScripts built for therapy. We can do multilingual. We also have, we haven't talked about it, we have integrated about 70 plus mental health forms like GAD-7 and ADHD forms and likes for initial intake, while other AI scribe companies are not doing that. We also have a 24/7 workflow assistance. I'll show you a quick demo of that if I'm able to. We talked about HIPAA, PHIPAA, GDPR compliant, and also we are able to easily integrate into an EMR or EHR as well, as long as the other EMR has open APIs. So that's a little bit about AI note-taking, which is our second use case. The third use case I wanted to talk about is a 24/7 chat window. So this is another one of AI use case that is actually picking up, especially in the mental health world. So this is what we call generative conversational AI for clients. So this is where if a therapist is busy or if they are not available, as an example, at 12 o'clock at night, I have a depression or an anxiety attack. And the therapist or the clinician is not available. So these are tools that you can put on your website or on your app, which will provide a 24/7 support. And the beauty of these tools, again, just in the interest of time, I'll try to show you a demo. The beauty of this is basically it learns from your own therapeutic notes as well. So as an example, if you're focused on couples therapy or family therapy, and you're using this and you're creating your own notes, so these tools are actually learning from it, and it will evolve and try to answer in a way that you would have responded or ask questions as well. So let me just do a quick, just in the interest of time, I know we are running a little bit behind. So I am actually going to definitely send you this deck. There's a link to it. So if you want to see a demo of them, please do click on this, and you'll be able to see a demo on the CliniAssist and also on the CliniScripts as well. I'm just going to move to my fourth use case, which is the workflow automation. Now, this is where I mentioned earlier in my presentation about automating repetitive tasks. So again, we have several use cases or automation activities that we have done. I'll talk a little bit about a couple of them. Actually, one of them, which we are working on, where a clinician had, a CEO of a clinic had more than 5 clinics, and each one of those clinics had their own receptionist. So they came to us and they said, 80% or 90% of the time, our receptionists are answering the same questions. What time do you guys open? Who's the physician? Can you send me a sick note? All these different questions that you get all the time. So we are creating a digital front end where it will be seamless, meaning when you call into a number, it's an AI agent, not an actual human being who will actually pick up the phone. It'll ask you what is your question, and it'll try to answer based on the database that you have provided us. And it'll be very, very seamless for the customer. He or she would understand that you're talking to an AI agent. But if an AI agent is not able to answer, then and only then they will escalate it to the receptionist. So long story short, the idea here is basically those 5 receptionists can start doing other things, and they will be able to see patients, they will be able to do intake, and not be on the phone 70-80% of the time. So you will have an AI agent, so they'll become much, much more productive. And there's some other use cases that we have put into the links as well. So in summary, to wrap up, as Dr. Brown also talked about, privacy, ethics, what I wanted to add to my use cases is basically the focus on mental health is very, very important. And I just wanted to give you a few examples of how some of these tools, AI Skype companies and AI chat windows, chatbots, and also this workflow automation work is being done in different clinics to be able to use the data that they have. And it all stays private, it all stays local. None of that data is stored outside and does not leave your premise as well. So I will, with that, as I said before, please, if you have any questions about what I've said, please put it in the chat window. We will have the last 5 to 10 minutes to answer those questions. And I will now hand it over back to you, Dr. Brown.
So I'm going to bring up a smattering of other issues related to the use of AI, just because I thought to put it into context. So the stuff that Nouman presented is rock solid. It's happening already. These are some of the things that maybe are starting to happen, might happen, or maybe should they happen or not happen. So I'll just review a few of them just so people can be aware of them, because it can put AI in a little different perspective. First, I want to talk about use by patients. And there was an interesting case that came up recently. A boy saw 17 doctors over 3 years for chronic pain. ChatGPT found the diagnosis. So this is.
Are you sharing your screen?
Oh, I thought I was, but maybe I'm not. Let me go back. I thought I clicked it. Oh, I didn't click it all the way. Now I am. Thank you for catching that. Can you see my screen now? Hello?
Yes.
Okay.
Yes, now we see.
Okay. So you saw 17 doctors. So the mom put the questions into ChatGPT and found the diagnosis. Diagnosis was confirmed by a neurosurgeon. Child was treated and got better. So whether we like it or not, patients are starting to use these tools to ask their own questions. They may get the right answers, they may not. This is a interesting example of where they got the right answer. There was also a study in the New England Journal of Medicine AI talking about how patients seem to trust the AI even more than the doctor's advice at times, even when it's not as accurate. So here's a study where they basically surveyed about 800 people and found that when the answers were accurate, they generally they trusted the answers more from the AI, which actually causes some problems because obviously not everything that's returned is that accurate. So it's a little concerning. This was a study that I was involved in that came up with frequently asked questions on colonoscopies, and then basically had the organization document the answers that they wanted to document, with the idea being that if you search the entire world, use the publicly available information, you may not get an accurate answer. So organizations, kind of as Nouman was describing with his chatbot, they're coming up with focused chatbots, which can be more accurate because they reference the information and are proofread by information for the organization. So there's various ways of dealing with that. Simplified patient instructions. I came up with something recently I thought was kind of cool, so I thought I'd show it to you guys. It's a use case for AI that you can do if you just have access to any of the tools. I'm going to show ChatGPT because that's what I'm most comfortable using. I just picked out an article here, bipolar depression, a review of treatment options. And if I go into my tool here, and I basically upload that article, and say, summarize article at a 6th grade level, it starts doing its search, it starts writing something up, and it starts giving the answer. So you basically can take something and have it summarized rather quickly at a level that patients who are literate can understand. And if you don't like it, you can then go and basically say, modify it the way you wish. I wouldn't do this without reading it first to confirming it says what you want it to say. But if you have some information you want to communicate with patients and you want to give them a written document, this is a way where the tool can help you summarize and make it and put it into a form that'll be good for patients. This one organization went through all their consent forms and found that the consent forms were not necessarily understandable by patients. And then it used these models to rewrite them at a whatever grade level, 6th grade level, so their patients can more consistently understand what is being presented to them. Screening and monitoring. Well, I think most people know that we do have questionnaires that can be used for screening and monitoring patients, but there's some new things being worked on. I don't think there's any commercial in this regard yet, but you can actually take cell phone data. You could look at things such as voice patterns, facial expressions, text analysis, just the level of activity, how much person moves around, whatever it might be. And from that, you can monitor and screen for things such as depression. There's one article I came across I thought was interesting, which is you can have someone talk on the phone, and there's software now that can detect Parkinson's disease by the nature of the voice. So these are the type of things coming out. Nothing that anyone can use right now, but it's something interesting to know that these are the types of things starting to come out. Role-playing exercises. So this is not for doing therapy, but sometimes you might ask someone to go home and try something and see how they do with it. And so here's an example of one that I was playing around with. This is not necessarily for mental health, but it just gives a feel for it. This is something that was used for the work environment for knowing how to give feedback to people. And it uses a style of inquiry called pure inquiry it was developed by someone named Edgar Schein. And what you do is you can pick a scenario. Let's say I'm going to pick, let's say number 4, resistance to feedback or coaching. And then it gives a scenario and you can role play different aspects. So you can imagine that people are going to start coming out with these so that not to do therapy, but maybe when you go home, say, why don't you practice a new skill? Why don't you try this out at home? Let's see how it works. And people can try it in their home as they wish. Let's see, in this case, I guess due to time, I'm not going to go through the conversation aspect of it, but it's basically you get just going to move on from there. Having said that, some of these role-playing things are a little bit concerning to me. Here's some data on the global AI girlfriend app market. So this is in billions of dollars. So people are starting to interact with these things in kind of interesting ways, which I'm not so crazy about. So, and this is probably an example where the free market with a profit motive may take things in a way that I may not be so thrilled with. So I'm hoping some of the good people on the phone will see this technology and say that maybe there's ways that mental health providers can use it more productively and more benevolently than is being used. But the tools can be used for good or bad. And this is just basically showing some of the power that's coming out of these tools in terms of what they can do. And finally, people can use these tools to actually provide therapy. There was an article in New England Journal of Medicine AI talking about a randomized trial of generative AI chatbot for head and mental health treatment. And it actually did quite well. You know, the patients improved with the chatbot, and in many cases it did better than with the therapists. What I thought was particularly interesting is when they had measures which had been used in prior studies to measure the therapeutic alliance, the AI chatbots did as well, if not better, than the humans that were being compared to, the human therapists. So these tools actually are starting to do things that I probably wouldn't have expected just a few years ago. Having said that, I should put some caveats in. They screened out the suicidality patients. They screened out mania, and they screened out psychosis. They also monitored this closely so that they looked at every question that went back and forth to the patient to make sure that there was nothing inappropriate being said. And obviously, that's not something that you can do in real life on a scale. But these are closely monitored, closely studied, and they made sure that the AI systems didn't make any mistakes. But it gives you an idea of the type of things being worked on. So things that Nouman presented are things that are ready for prime time. This is not ready for prime time, but in an environment where there are a shortage of therapists and the people do have trouble getting access, these tools will at least be attempts to make them broadly available for people who may not be able to get access to a human therapist.
Perfect. Thank you so much. So I know we have only a few minutes left here, and there was a couple of questions on. Sahib, was there a question that you wanted us to pay attention to? I guess one from Patty, which is how long are the AI notes available? I was told the program will keep notes up for 7 days and then they will be deleted. Maybe I can start with that and say if there's any other questions or if there's anybody who wants to ask the question. So on on most of the other AI scribe solutions, the notes the voice is recorded, the transcription is recorded, and the notes are saved within this AI scribe. So one of the things that we are trying to do differently because of all this privacy concerns, especially from the mental health practitioners, is that by default, we do not store a record. We do scribe in real time, and we give you the note real time within a few seconds. But we do not record any of the conversations, the notes, the transcript, or whatever is the output. So that's point number one. Now, there are some people, there's some clients who have said, because we do back-to-back sessions, we need to be able to go back at the end of the day and look at some of our notes. Only if you want, and if you turn on that that button in your profile, do we store the transcript and the notes for up to 7 days. We can even store it for a month or even a year, because there's some clients like Government of Ontario is forcing us to save it for at least a year, but that by default is not available. So just wanted to clarify, because yes, you will be able to save it for 24 hours, for 7 days, for 1 year, and for 1 year, for 1 month and for 1 year. But by default, that is not going to be available. We do not store data. We do not use your data. And you pretty much hit the clear conversation button on our tool, and it actually deletes from everything. Any other questions, please? Sahar, was there any other questions that you wanted us, either Sydney, myself?
No, there was a question from Dan. You answered it. Do you want to talk about it? Can you elaborate about AI administering and analyzing patient assessments? Is there any specific AI app that can help administer them automatically and analyze to see how treatment is working?
Yeah, so that's an amazing question. So we have a solution that we have developed, because we are an AI. We are trying to develop AI tools within mental health. So we did talk about the AI note taking, which is a solution that Sydney elaborated on. But we have other solutions, like I did talk about a 24/7 chatbot, but we also have another solution which is called CliniScripts. And maybe we'll try to keep it for the next session, but high level, we have integrated almost about 100 different mental health forms into that solution. So you as a psychologist or a psychotherapist or a mental health professional, you can go into that tool and you'll make it very, very simple. With one touch of button, you'll be able to send those forms to the patients, and as soon as the patient fills up the form, the AI takes care of the rest. And what I mean by that is that it looks at the responses, it creates the table for you, and it creates a whole report for you. But you as a therapist still have to go in and review it and make sure that the report is aligned and you can see the table, the tabular responses and everything. But that's a tool that we have already developed, and be bringing that into the market as we move forward. I hope that answers the question. Any other questions?
No, there are no any more questions in the chat.
Okay, perfect. Thank you so much. Again, as I said before, I really, really appreciate Sydney. Thank you so much, Dr. Brown, Michael, Lloyd, and Sahar, for you organizing a lot of these things. And we will definitely be sharing this link. We have recorded the conversation. We will be sharing it via email. And so please put in your email so that we can download it. And we are available to answer any questions that you might have. Thank you. Thank you so much, guys. Thank you, everybody.